Good morning, dear students. In the last class, I think we missed one class in between. But anyway, before that, we have dealt with the anatomy of the larynx. How larynx is the one which is the first part of the lower respiratory tract. As you know, the respiratory tract starts at the anterior nares in the nasal cavity, and then nasopharynx, then the oropharynx and hypopharynx, and then it is the larynx. That is the first part of the lower respiratory tract. Now we have seen the division of the pharynx into nasopharynx, oropharynx, and nasopharynx is the one which is purely for the air passage, whereas the oral cavity, the oropharynx, is both for food and also the air. Both the passages are there. And if you come down into the laryngopharynx, once again, it's a common passage for the food as well as the air. Now, the larynx is opening into the hypopharynx, and the structure of the anatomy of the larynx, which you have seen, I'll just try to brush up that. This is how it is. You have got the epiglottis, you have got these epiglottic folds on either side, and you have the false vocal cords, which are otherwise called the vestibular folds, and you have the true vocal cords. These are the true vocal cords. And the space in between is in between the false vocal cords or vestibular folds and the true vocal cords is called the vestibule. Okay, so this is like a tube, and in this tube there are these structures, the false vocal cords, the true vocal cords, and the epiglottis, which is above, and the aryepiglottic folds. So these are the ones which the larynx is adapted to see that it is performing certain functions. And if you see the functions of the larynx, the protection of the lower airway is the primary function of the larynx. Usually the larynx is otherwise called as the voice box, but voice production is it's a secondary function. The primary, most important function, the number one function of the larynx is the protection of the lower airway. That's the function. Then of course the phonation, the passage of air into the lungs, the chest fixation, and various other things, the cough reflex, these are all the secondary functions of the larynx. Okay. Now let's see how these functions are performed by the larynx. Now the first one, as I said, is the protection of the lower airway. When we say the important function is to prevent the food, the water, the saliva, or any foreign bodies entering into the larynx, and how it reacts and tries to see that they are not entering into the larynx first, and secondly, by any chance something enters, how they are propelled out or thrown out by the cough reflex. That is what we are going to deal with that. And when I say this, I remember one story which we studied or which we heard during our school days. There is a king, and when there is a king, there is a queen, and both of them are there is a prince. Now usually the tradition in these families is whenever a child is born, a prince is born, the astrologer comes and then says, okay, what is going to be his future, how bright is it, and what are the problems, any problems if there are any. And the astrologer predicts that on the 5th birthday, the prince is going to die. Okay? And since he's a king, the prince starts growing, 4 years, and 5th year birthday comes, and the king says, close all the water bodies in the kingdom. And because the astrologer says the mode of death is by drowning. Drowning is the mode of death for this prince. So he says, the king says, stop, cover all the water bodies, and on the D-Day, that is on the birthday of the prince, everybody assemble like an assembly, and the prince is made to sit in the center, and the child sits there for some time, 1 hour, 2 hours, 3 hours, and after 5 hours, 6 hours of waiting, he feels thirsty. When he feels thirsty, he says, I would like to have some water. So all the water bodies have been covered. So the king says, wait for some time. And as you know, the prince starts crying. And when the prince is crying, he says, okay, he ordered, the king orders one of his ministers to get a jug of water and give it to the child, to the prince. Then the prince was so thirsty, when the minister tries to put it in a small tumbler and then give it to the prince suddenly grabs the entire water jug, and then, because he is so thirsty, and suddenly tries to drink the water in a very hasty way, and in the process the water enters into the respiratory tract, and suddenly the prince dies. So the drowning doesn't require big pool of water like a lake or a river or a sea. Just the amount of water which can fill the lungs is sufficient to drown the person. So the most important function of this larynx is to prevent such an occurrence of this food or air pass or the water going into the respiratory tract. For this, there are certain methods that the body or the reflexes of the body maintain. Now, the first 3 levels of obstruction or closure of the larynx are first the aryepiglottic folds. The aryepiglottic folds, these are the ones, aryepiglottic folds, which are like that, circular. Okay, they are the ones which close first, and then the false vocal cords are the ones which get approximated like that, and the true vocal cords are the third line of defense. So the true vocal cords have very powerful adductor muscles, and so the true vocal cords certainly they come together and close the entire inlet of the larynx. So that is how there are 3 levels. That is the aryepiglottic folds to some extent close the passage, then the false vocal cords, then the true vocal cords, and so the entire laryngeal inlet is closed if there is any saliva or food trying to enter into the this usually happens during deglutition when you are swallowing. Now for this, the swallowing actually during swallowing, which is divided into 3 phases: the oral phase, the pharyngeal phase, and the esophageal phase. Now in the oral phase, the mastication, and then it mixes, the food mixes with the saliva, and then it's made into a bolus. Then it is by the movement of the tongue and touching the palate, hard palate, the bolus is pushed into the pharynx, into the oropharynx. So till now the process is voluntary, and once it comes into the pharyngeal phase of deglutition, there is a continuous reflex action that is taking place, because the 9th nerve and the 10th nerve are the ones which act as the afferents and efferents, and they are the ones which give the direction how the food has to be propelled. Initially the soft palate is made to rise up and close the nasopharyngeal isthmus so that the food doesn't go into the nasal cavity. Then there is the food is propelled into the oropharynx and then into the hypopharynx, and this is the epiglottis. The epiglottis, during which time the entire larynx is brought forwards, and the epiglottis folds itself like that and almost blocks the laryngeal inlet, and the food is propelled directly into the esophagus, into the hypopharynx and pyriform fossa, and the cricopharyngeal sphincter is the one which immediately responds by relaxing, and the food is propelled into the food passage, into the esophagus. So this is what happens during deglutition. During deglutition, when there is a small duration of time when there is a cessation of the breathing. So this is what is the deglutition process and how it is governed by the reflexes. Then you have another reflex which is called the cough reflex, which is also again in 3 phases: the inspiratory, the compression phase and the expiratory phase. Initially what happens is the mucus is something which is secreted continuously in the respiratory system, which is nothing but by the pseudostratified ciliated columnar epithelium. That is the one. Mucus is continuously being secreted, and sometimes this mucus becomes a little thick and gets adherent to the walls of the either the bronchi or the trachea. Then if this mucus, initially what happens is there is a forced inspiration, stage 1, and then the glottis is closed, and there is positive pressure built up by the diaphragm and the chest muscles, and the positive pressure is built up, and suddenly the glottis opens, and the entire force of the air, almost 100 kilometers per hour is the speed with which the air comes out, and so that pushes the mucus into the hypopharynx, and from there you either swallow or spit it out. So this is called the cough reflex. So the primary function of this larynx is to prevent the food or water going into the respiratory tract, is the primary function, and the secondary function is the phonatory function. Both are important because if there is a problem with the respiratory system, without breathing you can maybe survive for about 8 or 10 minutes, whereas without food, without water you can survive for about 8 days, and without food and water maybe 2 months or so. So this is what it is. So the priority is always to the air passage, air passage safety. So this is what you should remember. And then the voice production, as I said, is the secondary function. Now the voice production requires activating reservoir, that is, these are called the bellows. They are called the bellows, so which have the air, and the vocal cords are the ones which are like the reeds. You know, like in a trumpet, you have got when you blow, there are these reeds which vibrate and produce the basic sound, basic vibration sound. and this sound is passing through vibrating chambers of these pharynx, the chest wall, and the nasopharynx, the sinuses, and they are the ones which form these chambers where the resonation takes place, voice resonation takes place. And this voice resonation, along with the movements of the tongue, various kinds of speech is produced. Okay, so we'll see how this is happening. So basically, you have got the lungs, which are the reservoir of the air, and as the air pushes the vocal cords, which vibrate and produce the basic sound that is being produced, and this is altered by the resonating chambers of the vocal tract, and ultimately with the articulation, the movements of the tongue, the articulation, the speech is developed. This is the basic mechanism of voice production. Now, the voice production, voice is also important, particularly in the human race, because this is the one which makes you to express your feelings in the society. So a person who can who has got a good speech and the connectivity with the people around is a successful person. So much of importance is given to the voice production. Now this is once again the same diagram to tell you that lungs are the ones where the air is filled in initially, and then that is slowly pushed through the glottis, which vibrates the vocal cords, and these vibrations are altered, or there is a resonating chamber, and from there, and you have the tongue which articulates and produces various syllables or the speech. So this is the basic mechanism of vocal production. Once again, same to emphasize, the glottis is the one where the basic source vibration occurs. The vocal tract frequency is the one, the chambers, resonating chambers, and the oral ultimate output, this is the one which we hear as speech. Now various theories have been put forward when how the sound is being produced, the speech is produced. So basically, neurochronaxic theory, which says that vibration of the vocal fold muscles, because every muscle contraction is by the nerve stimulation. So they said it is because of the nerve stimulation that is vibrating the vocal cords, and so this is the first theory that has been proposed. But they said this cannot happen because the number of times the vocal cord vibrates, the muscle contraction and relaxation cannot happen, because when the muscle contraction you require the acetylcholine to be released, and then that from the synaptic junction acts on the muscle, and then the muscle contracts. So neuromuscular junction, it takes time. So they could not explain the kind of frequency that is happening in the vocal cords and correlate with the neuronal stimulus that is getting from the brain center. And they also found that even paralyzed vocal cords, when they paralyzed vocal cords, and if air is pushed from below, these vibrate and then produce this sound. So the passive phonation occurs in the excised laryngeal structures. So this is neurochronaxic theory, which is initially proposed, could not explain these things, and so it has become obsolete. Then we have these combined aerodynamic and myoelastic theory. As you know, the vocal cords are the ones which are supplied, which have the muzzle. The muzzle is the adductors which are powerful. So there is a contraction of these adductor muscles, and the vocal cords are brought together. And the air that passes between them separates these vocal cords initially, and when there is a vocal cord separation, the air escapes. When the air escapes, there is a negative pressure created, and so because of the elasticity of this muscular tissue, the vocal cords get approximated again. So this is by the Bernoulli's phenomena, wherein the subglottic pressure increases, the vocal cords which are adducted during phonation, they get separated, and small amount of gush of air escapes, and so when the air escapes, there is a negative pressure. That's the Bernoulli's phenomena which says, and so the vocal cords come together again, and then that's how the basic mechanism of vocal cord vibration is explained by the combined aerodynamic and myoelastic theory. So which is the present day explanation that is given. So this is once again a diagrammatic representation of these vocal cords, which has got a thickness. This is the mucosal surface. Here the vocal cords are together, and when the gush of air that is coming from the lungs pushes the vocal cords, initially the vocal cords get separated at the lower end, and then slowly the upper end also opens, and so the vocal cords are separated, and that is the time when the vocal cords vibrate. And when the small gush of air escapes, there is a negative pressure that is occurring, and so once again the vocal cords start coming together. They come together, and usually the base is the one which closes, see, and then the apex, and so the vocal cords are adducted again. So this is the basic mechanism that is occurring, and this aerodynamic myoelastic theory is the one which explains clearly the amount of vibrations that are occurring in the vocal cords to produce the basic sound. So this also has been studied by stroboscopic examination, which clearly tells us about the movement of the vocal cords. Now the basic voice generation is, the voice has got three qualities. Voice has got three qualities. One is the pitch or the frequency, which depends on the frequency. The intensity is the one which is the altitude, which depends on the amount of vibration altitude. The third one is called the timbre. These are the three characteristics of the voice. One is a high-pitched voice. Some people, particularly ladies, females, they have a high-pitched voice. And low-pitched voice, for example, Amitabh Bachchan, has got a bass voice. And the falsetto voice is another voice that is described, wherein there is a tense vocal cords and only the edges of the vocal cords. These are, it's also called false voice. Okay, these are usually used by the singers. So these are the, as far as the pitch is concerned, these are the various kinds of pitches that are being described: high, low, and the falsetto, which is quite a high pitch. So this is usually used in these by the singers. So this is as far as the pitch is concerned. Pitch is number of it is directly related to the frequency, number of vibrations per second. The other one, as I told you, is the intensity, is the loud sound. Some people talk very slowly. Some people keep talking even if the person is very close by, start shouting. So that is the intensity. Third one is the timbre or the quality. The quality of a person, of the voice depends on, of course, the basic structure of the vocal cords and the vibrating mechanism that is there in each individual. If there are two singers who are singing in the same pitch and same intensity, you can differentiate because there are what are known as overtones that are produced. So even if they talk, you can easily identify the person by the voice quality, that is quality, otherwise called the timbre. With this, we go into the vocal cord structure. Vocal cord structure is got a mucous membrane, and above the mucous membrane you have the mucus. Mucus is something which is continuously there in the lining the respiratory tract, and that the mucus is the one which is almost like a lubricating surface. So if the mucus secretion becomes reduced, particularly in patients, people who are tensed up, then the vibrations come down, the speech gets altered. Then you have the mucous membrane, which is stratified squamous epithelium, under which there is a ligament, the vocal ligament, and under which is the muscle, vocalis muscle. So this is the basic structure of a vocal cord. Let me go back to the original picture of this. Yeah, this is what it is. So the vocal cord has got this superficial layer and the submucosal, the stratified squamous epithelium. Then you have the submucosal layer, which is again further divided into various spaces, and the muscle. This is the basic structure of the vocal cord. Voice used by the singers with a high pitch. Not much of an activity in the vocal cord, vocal ligament and the muscle. It's just the mucosa. High vibrations occur and then give rise to that falsetto voice. So with this, they have also found out that various states, various grades of the vocal cords. When the vocal cords are together, it is totally, air passage is totally blocked, and if the vocal cords are separated a little like this elliptical, it produces a creaky voice, and this is the one where you have the both these blocked, and so it's stiff, there no voice is produced. Then you have these modal, which is the one which is the frequent, which is used by the normal speaking people, normal speech, and maybe in singing to some extent. This is the modal voice which is commonly used for the speech, and here there is the space has become a little more, and so the voice that is produced is not very clear. And if this adduction and the abduction of the vocal cords is furthermore, it produces a breathy voice that is whispering. And if the vocal cords are totally apart, it produces a kind of only air passing through and no voice is produced. So these are the various states of the vocal cord position, which produces various kinds of voices. Now with this, we go into the vocal registers, which are considered as the registers of that is the pitch. Vocal fry register has got a lowest vocal register, wherein something like, as I told you, the speech of Amitabh Bachchan, bass voice. And the modal voice is the register wherein commonly used for speaking and singing. The falsetto is high pitch, and whistle register is the highest voice register used by female singers. So this is how the vocal registers are being classified. Then these are the musical notes. We will not go into the details, it's only for the, and the voice resonation, resonating chamber is being altered. The voice resonating chamber, basic voice is the produced in the vocal cords. Resonating chambers, the vocal tract, the hypopharynx, the pharynx, the oral cavity, nasopharynx, the nasal cavity, and the chest. These are the vibrating chambers. Now these are vibrating chambers are altered by the movement of the tongue, and that produces different kinds of vowels, and this is how the speech is described. There are some words which are by the movement of the lips, the teeth, the labials, from the tongue tip touching the palate, or the entire tongue touching the palate. So various sounds are being produced, and the air, when it passes through the nasal cavity and produces the nasal vowels, and this is how they are described. The bilabials are both lips, okay, and these are the words that are being described once again. The bilabials like the P, B, M, W, and these are the labial, dental, alveolar. So the tongue alters the vibrating chamber and produces different kinds of sounds. Now we go to the other function of the larynx, which is called the chest fixation. If you have to do a kind of either pushing during vomiting, defecation, micturition, climbing, you just have to close the glottis and fill the chest with the air, and then that pushes the diaphragm down, and you can exert pressure by further increasing the pressures of the abdomen, and then you can this helps in the defecation, micturition, and also in labor. Okay? And then with this brief introduction of the voice and its production and the various functions of the larynx, the primary being the protective function, the secondary being the voice production and chest fixation and the cough reflex. We come to voice disorders. So voice is something which is well developed in the human beings and which is widely used, and the vocalization is the basic production of the sound at the emotional level, whereas phonation is the speech production, is something which is with which you can communicate with people and which is the most important function for a human being to be successful. So it is that is the reason why we study about the various sounds that are being produced and the communication system. Now the components of phonatory apparatus are, as I told you once again, the lungs, the vocal cords which vibrate and generate the voice, basic voice, the resonators, once again the pharyngeal passages, the articulators, the palate, tongue and lips, teeth. And the coordination of phonation originates in two centers in the brain, the limbic and the primary motor cortex. So that we'll see some of the structures, how they, when there is a problem, produce a voice difference. Now this is once again the same picture which I have shown you earlier, the basic vocal cord vibration, the resonating chambers, and how the tongue alters the various the resonating chambers produces different speech. Now this is initially when I told you the aryepiglottic fold. This is the aryepiglottic fold, and that is the epiglottis. So this is the one which closes first. Then you have the ventricular folds which close, and the vocal cords. These are the three ways wherein you have the entire larynx gets closed during deglutition, so that it prevents the food or water or the saliva entering into the larynx, the protective function. Once again, same diagram. This also shows us the structure of the vocal cord, the squamous epithelium. Then you have the submucosal layer, the ligament, and the muscle beneath that. This is the section. Now this is what it is. Submucosally there is a space where the tissue is very loosely attached, and that is called the Rhinolalia space. Below that, of course, the vocal ligament is a strong one, and below that is the muscular. This is the once again the section diagrammatically represented. So that is the mucous membrane, and submucosally there is a space which is loose strands are there. That is the Rhinolalia space, and then you have the ligament, vocal ligament, and deep to that is the muscle. Just I want you to understand the same thing again. That is the squamous epithelium, the mucous membrane. Just below that is the Rhinolalia space, then the vocal ligament and the muscle. Then once again same repetition, the basic glottal or supraglottal region, the basic vibrations occur, true vocal cords and the false vocal cords. The basic sound is produced in the vocal tract. They act as the filters or the vibrating chambers, and speech, ultimately the speech comes out, and that is what speech is the one which we hear. So this is again the studies that have been done, and the classification is usually it is the disorders of the voice. Disorders of the voice are usually classified as organic, wherein there is a structural change of the vocal cords, either because of the edema, nodules, changes because of the aging. Then you have the neurogenic, where there is a nerve weakness, neuromuscular problems, and vocal cord, the spasmodic dysphonia, and paralysis of the vocal cords, how they interfere with the noise, the basic production of the voice. Then you have these functional voice disorders, which are usually because of the fatigue and the muscle tension, dysphonia or aphonias, and ventricular phonations. These are the functional problems that are. And you have the psychogenic. The psychogenic are the ones because of the psychological factors. They produce sometimes aphonia or dysphonia, the psychogenic causes. Now this is another classification where speech impairment occurs. The fluency disorders like the stuttering, the cluttering, some people speak so fast, the articulation disorders, and the voice disorders, the pitch quality and loudness, and language impairment because of aphasias, various kinds of aphasias that are described because of the problem in the brain, the speech center in the brain. Then we come to another disorder which is called the hoarseness of voice. Voice has got a particular quality and something standard normal voice, and if there is a deviation, change in the voice, that is called the hoarseness of the voice. Now this hoarseness voice quality becomes harsh and rough, and sometimes it's so weak. That is called the hoarseness of the voice, and this results from variation of various periodicity, intensity, consecutive sound waves that are produced during vocalization. So the causes of hoarseness are the loss of approximation vocal cords coming together, the increase or decrease in the size, thickness of the cord, which are varied by the muscles, and stiffness also controlled by the muscles, various muscles that are acting on the vocal cord. Now, for which you have to go for an evaluation by the history, how it started, and the indirect laryngoscopy is another tool wherein you can examine the movement of the vocal cords or find out some organic lesions, the inflammatory conditions, or the vocal cord paralysis. Then you have the video laryngoscopy, wherein you would like to see the movement of the vocal cords, how they move, And stroboscopy, it is the rate at which the vocal cords are moving, the mucosal movement, the muscular movement, everything is reflected in this stroboscopy. And of course the electromyography, where there is a weakness of some muscles, which can also give rise to the change in the voice. Now we will go into some of the disorders which tell us about the hoarseness of voice, the conditions of hoarseness of voice. One is called the dysphonia plicaventricularis, which is quite commonly seen. This voice is produced basically by the false vocal cords. That is, I'll show you the diagram again. It is produced by not by the true vocal cords. It is by the false vocal cords, and the voice is not as good as the true vocal cord voice, the voice that is produced by the true vocal cords. And this usually occurs in people where there is a problem in the true vocal cords, either paralysis or a fixation or surgical excision of some kind of tumors, and so the true vocal cords are not functioning properly, and so the function is taken over by the ventricular voice, and this ventricular voice is rough and low pitched and very unpleasant. So that is called the dysphonia plicaventricularis, and usually there is some kind of a psychological element, psychogenic element. Sometimes if these organic lesions are not there, in this type voice becomes normally but soon becomes rough when the false cords start taking over the true vocal cord functions, and treatment is by speech therapy. So this may be asked as a short note: dysphonia plicaventricularis. That means the vocal cords are not vibrating properly, and the function is taken over by the false vocal cords. These are the false vocal cords. They move and then produce the sound. And the other one is the puberphonia. Puberphonia, as you know, the child voice, male and female, both are same, high pitched, and when the child grows, if it's a male child, there is at the age of puberty, there are some hormonal changes which increase the thyroid dimensions, thyroid cartilage dimensions, and so there is a lengthening of the vocal cord which normally happens, and so the pitch comes down. The pitch of the male is a low pitch because it's a long. The vocal cords become long because of the enlargement of these thyroid cartilage. So usually that is a normal phenomena, but in some children who are first born and who are very emotionally attached to the mother, and they do not want to accept themselves becoming a male, because you have to, as a male, you have to perform some duties. So they would like to preserve their female voice. In the process, they have developed some kind of a double voice. They develop a kind of a double voice. Sometimes it's a female voice, sometimes it becomes very hoarse. So the treatment is usually speech therapy again, and there is a small test that can be performed, which is called Gutzmann's pressure test, wherein you press the thyroid prominence, press it backwards and downwards, so that is the one which reduces the length of the vocal cord, and so the voice can be a different kind of a voice is produced because there is a change in the length of the vocal cord. Now, phonaesthesia this is a weakness. Phonatory muscles are being used, just like in myasthenia. The phonaesthenia, you're talking, and then slowly, as you are talking, the patient becomes fatigued and the voice comes down. So that is one condition wherein you will see there is a muscular, the muscle which is extending from the arytenoid to the thyroid. Thyroarytenoid muscle is the one which is becoming weak, and so there is a space there, and this space where you have the posterior postcricoid muscle, posterior part which are there, they become weak, and so the adduction doesn't take place properly. So that produces a gap there and produce a change in the voice. So this is the phonaesthesia, wherein the voice becomes hoarse. The treatment we'll describe the treatment later. And the functional aphonias, wherein for various reasons the patient has got a problem, but they do not want to tell their problem directly because they don't get the attention. So in order to attract the attention, they stop talking, and then the talking is usually a whisper kind of a talking. They will not speak normally, and suddenly they go into whisper, and this is almost a sudden occurrence that happens. So the patient's relations bring saying that the patient has suddenly stopped talking and the voice is gone. And so this is a voice, the patient is talking all right, but he is talking in a whispering voice, as at the end the relations feel that the voice is gone. But if for such people, when you do the indirect laryngoscopy or touch the postal wall of the pharynx, the cough reflex is normal. That means the vocal cords are adducting normally, but the patient doesn't want to adduct them, and then in the process the whispering voice is the one which they in which they speak to attract the attention. So this is called the functional aphonia, wherein the treatment is psychotherapy. Then spasmodic dysphonia, where there are spasms of these muscles, and so the spasms can be the adductor muscle spasm or the abductor. So both of them produce kind of a voice disorder, and so the treatment in such conditions is by the injection of the botulinum toxin. And botulinum, as you know, basically is the one which this is the synaptic junction, that's the nerve ending, and that's the muscle. So the acetylcholine is released, and so that the muscle starts contracting. Okay, so when there is the acetylcholine that is being released, is contracting the muscle and allowing it and going into spasm, the botulinum is the one which reduces the release of the acetylcholine, and so the muscle is not contracting. That means it is relaxed. This is how the botulinum toxin, neurotoxin works. Then that is how the injection is being given for adductor and as well as the abductor dysphonia, spasmodic dysphonia. Then stuttering of the speech, fluency of the speech, is because of the which is otherwise commonly called as the stammering. And the usually it is better that the parents do not interfere with the child's fluency or the way the child is speaking, and at the most he may require a kind of a therapy, psychotherapy, and see that some kind of a speech therapy, so that the child starts to live with a small difficulty. The Rhinolalia Clausa, this is because of the air that is not passing into the nasopharynx and into the nasal cavity. So the nasal chambers are totally cut off, and so it produces a kind of a voice which is called Rhinolalia Clausa. And usually any obstruction in the nasal cavity, polyps, tumors, or the nasopharynx obstruction where the air doesn't go into the nasal cavity. That produces peculiar voice which is called Rhinolalia Clausa. And Rhinolalia Aperta is the other condition, the reverse, wherein the nasopharynx is directly connected, nasal cavity is directly connected with the oral cavity, and so there is a high resonating chamber, and this produces a voice particularly seen in the cleft palate. Sometimes in some conditions velopharyngeal insufficiency and soft palate fibrosis. Several conditions are being described, which produces the air to directly go from the oropharynx into the nasopharynx. So all the chambers, nasal cavity vibrate, and so produces a kind of a voice which is called Rhinolalia Aperta. Then these are some of the conditions: hyponasality and hypernasality. Then another voice which is being described is the potato voice, which is kind of a muffled voice. This is because of the obstruction at the tonsil level or hypertrophied tongue, base of tongue, some kind of a growth, or a cyst in the valvular region, or epiglottitis. That is the area in the oropharynx where there is some kind of an obstruction, produces a peculiar voice which is called the potato voice. And there is another condition which is called the Mogiphonia, where there is a phonic spasm. This is usually occurring in people with professional neurosis, like the singers, the teachers, and the clergymen. So the treatment is usually the vocal rest and speech therapy. And if there is any underlying problem, the psychoneurotic problem has to be dealt with. Yeah. So ultimately summarizing whatever we have said, larynx is adapted to perform certain functions. Basic function is the protection of the lower respiratory tract, and how it does by the three layers: the aryepiglottic fold, the false vocal cord, and the two vocal cords closing, and the laryngeal inlet being closed when food or water tries to go inside. The second function, most important function, is the speech, and how the speech usually occurs by the vibration of the vocal cords, the various theories that have been proposed, and how the speech is basically produced in the vocal cords. There is an alteration in the vocal tract, and ultimately by the articulation, speech is produced, and that's what we hear. And how this speech can be altered by organic, neurogenic, psychogenic factors being dealt with. And so just go through the presentation once again. If you have any doubts, you can always come back with the doubts when you come to the college. Thank you so much.